I'm Paula Holland, Senior Lecturer in Public Health at Lancaster University. For the last 2 years, I've been leading the inclusive remote and hybrid working study. With academic partners and wider stakeholders, we've surveyed over 1,700 disabled people about their experiences of remote and hybrid working and how these ways of working can be best designed and implemented to help disabled people thrive at work. The COVID-19 pandemic changed the way many of us work. Being able to work remotely for all or for part of the week is now commonplace for many people with desk-based jobs. And it's important to understand the advantages and disadvantages of remote and hybrid working for disabled workers for 2 reasons. Firstly, in the UK, 23% of working age people are disabled, and the number of people who are disabled is growing. So it's really important disabled people's views are considered when employers design working practices. Secondly, disabled workers' experiences are important because their employment rates are much lower than those of people who aren't disabled. This is due to discrimination against disabled job applicants and disabled workers, organisations not offering flexibility over when, where or how work is completed, and disabled workers lacking access to reasonable adjustments, which are the specialist support and equipment that the Equality Act requires employers to provide to help them do their job. Being able to work from home can be a reasonable adjustment according to the Equality Act, but many disabled people have told us they weren't allowed to work from home before the pandemic. Nowadays, remote working is more widely available. Many businesses have continued to allow desk-based staff to work remotely all of the time, while others have introduced hybrid working, where staff spend time working both on site at the organisation and remotely. However, some businesses have decided their staff must only work on site. Yet in our survey, 71% of our disabled participants said ideally they would like to work remotely for 80 to 100% of their time. And 79% said they would not consider applying for a job if they couldn't work remotely. So why did we find such a strong preference for remote and hybrid working in our study? Most disabled people who took part in the survey said being able to work from home had benefits for their health and work. 90% said they could best manage their health condition or impairment from home. In fact, most felt remote working was positive for their physical health, their mental health, their work-life balance, personal relationships, and parenting and caring responsibilities. 67% felt more productive working from home. Only 6% felt more productive working at their organisation. Interviews with some of our survey participants revealed why working remotely was positive for their work and health.
For me, remote working has been an absolute lifesaver.
I really like how easy it is to pace myself. So if I need to get a drink or take a break or lay down on the floor for 5 minutes, I can do that, and it's a lot easier to do at home than it is in the office.
So much easier than if I had to go through all the effort of getting dressed, driving to the meeting, being at the meeting and then driving home. It just cuts all that exhausting work out and I can focus just on the meeting.
I'm on the autistic spectrum, and dealing with the office environment on a day-to-day basis is incredibly challenging. And remote working has just taken all the difficulties away.
Hi, I'm Dr. Callum Carson, a Senior Research Associate on the Inclusive Remote and Hybrid Working Study. Beyond speaking to workers, we also spoke to a number of employers about what they were doing to help support their employees to work in a remote or a hybrid way.
By working remote and accepting that people are going to be remotely working, you actually have a greater spread with regards to looking for people who you can bring into the team.
Candidates for jobs were consistently asking about our approach to hybrid working when they were interested in roles. This was even before they asked about basic things like salary and pension. It was so clear that hybrid working and flexibility was at the top of their agenda, and we clearly could see that it needed to be at the top of ours too, to attract the best talent.
It's important to give workers choice over their work location wherever possible.
When I worked permanently in the office, I felt isolated. I couldn't engage with my colleagues as effectively as I can now.
I would say that home working lets me continue working. It's that simple. I think the adaptations that I need, they're not so much equipment, they're more the ability to be able to rest regularly, like take regular breaks throughout the day, and then I can rest and recharge.
For me, it allows me to manage my health during the day, so I can go and have some quiet time or a nap if I need one. It also means that I'm not distracted by conversations and colleagues in the office, especially as it's small.
So what are the challenges that employers face to ensure that those 1 in 3 people, that more disabled people and people with other health-related conditions can work from home?
The statistic was 1 in 3 of our disabled people wanted to work from home more than they were able to. So it was a kind of a measure of unmet need.
Yeah.
So in terms of implications for employers, what came out from both sets of data from disabled workers and employers was the need to consult staff on their needs and preferences. So we've had this kind of almost like a natural experiment, the pandemic. It's offered a lot of people a first taste of remote working, and overwhelmingly in our study, people reported benefits for their health and well-being, and work outcomes, productivity and so on. And actually, a lot of the employers also echoed that. They actually agreed that it had in their organisations, it either increased productivity or at least not led to a decline in productivity. This study is a collaboration between Lancaster University, the Nuffield Foundation, Manchester and Metropolitan University and University Inclusion. We would sincerely like to thank our funders, the Nuffield Foundation, and to everybody who took part in our survey or interviews. Thank you.